we are going to do the MCQs of medicine from the endocrine system. Why this is important? Because nowadays they are asking many questions from the endocrine system. So let's begin with the first question. Nuclear transcription factor PIT1 is now called as A POU1 F1, B POU1 F2, C POU1 F3, D POU1 F4. What do you think is the correct answer here? It is POU1 F1. Peak ACTH. Peak ACTH secretion occurs at A 4 a.m., B 6 a.m., C 8 a.m., D 10 a.m. It is 6 a.m. This ACTH secretion is versatile with circadian rhythm, peaking at 6 a.m. and reaching a nadir around midnight. Now, this adrenocorticotropic hormone is secreted by anterior pituitary gland, and it plays a key role in regulating the cortisol levels from the adrenal cortex. The secretion of ACTH follows a diurnal circadian rhythm with distinct peak and trough periods. So the correct answer here is B6A. Bardet-Biedl syndrome is characterized by A. Mental retardation, B. Renal abnormality, C. Obesity, D. All of them. It is all of them. Which of the following gene is associated with Prader-Willi syndrome? GnRH1, PROK2, CS7, SNRPM. It is SNRPM. Please click the link in the description box to join the 3-day Ultimate Neet PG Breakthrough Blueprint event. Lymphocytic hypophysitis occurs mainly in A. Unmarried female, B. Postpartum female, C. Short stature female, D. Infertile female. It is postpartum female. Lymphocytic hypophysitis occurs mainly in postpartum women and presents with hyperprolactinemia and a pituitary mass on MRI. It resolves after prolonged glucocorticoid treatment. It is an autoimmune disorder characterized by inflammation of the pituitary gland, often occurring in women during the late pregnancy or postpartum period. The precise cause of lymphocytic hypophysitis is not understood clearly, but it is believed to be related to aberrant immune response. Gene associated with Unwer-Rich-Lundborg disease is A. CSTB, B. DEP-DCA5, EPM2A, LGL1. It is CSTB. Unwer-Rich-Lundborg disease is also known as progressive myoclonic epilepsy type 1, EPM type 1. It is a genetic disorder characterized by myoclonus and tonic-clonic seizures. Chromosome abnormality is in the CSTB, and the gene involved is cystathionine. Which of the following statement about Lennox-Gastaut syndrome is true? Multiple seizure type. EEG shows slow spike and wave discharge. C. Impaired cognitive function. D. All of them. It is all of them. Characteristic of Landau-Kleffner syndrome include A. Auditory agnosia or word deafness, normal hearing, abnormal electrical brain activity, all of them. This Landau-Kleffner syndrome, there occurs gradual or sudden loss of ability to understand and use spoken language. All children with LKS have abnormal EEG and have epileptic seizures, usually at night. Hearing tests show normal hearing. Gun barrel syndrome is best related to A. Anton syndrome, Balint syndrome, Claudius syndrome, Wallenberg syndrome. It is Anton syndrome. CADASIL is due to mutation in which gene? Notch1, Notch2, Notch3, Notch4. It is Notch3. Pentobarb coma refers to coma due to accidental ingestion of barbiturate, coma due to barbiturate, induction of anesthesia, high-dose barbiturate for refractory elevated ICP. It is high-dose barbiturate for refractory elevated ICP. Polycystic lipomembranous osteodysplasia with sclerosing encephalopathy is also called as Nasu-Hakola disease. PLOSL, polycystic lipomembranous osteodysplasia with sclerosing encephalopathy, PLOSL. It is also called as Nasu-Hakola disease. Is an autosomal recessive disease due to mutation in TYROBP and TREM2 that are expressed in microglia and osteoclast. There occurs delayed differentiation of osteoclast and microgliasis, resulting in an imbalance of bone remodeling capability, leading to bony cyst formation, inflammatory and immunological imbalance in brain, resulting in brain atrophy and dementia. Which of the following procedure is used for correction of TGA? A. Mustard procedure, B. Sending procedure, Rastelli procedure, D. All of them. It is all of them. Tarenfulvil and semaglutide are A. Estrogen analog, B. Vaccine, C. Gamma secretase inhibitor, HMG coreactase. It is gamma secretase inhibitor. Dementia pugilistica is related to which of the following? Non-convulsive seizure disorder, transient global amnesia, chronic metal exposure, chronic metal exposure, recurrent head trauma in boxers. It is recurrent head trauma in professional boxers. So it is dementia pugilistica is related to the recurrent head trauma in professional boxers. Let's move on to the next question. Familial Parkinson disease is associated with mutation in which of the following genes? A. PINK1, PINK1, DJ1, Parkin, all. It is all of the above. Familial Parkinson disease is associated with mutation in leucine-rich repeat kinase 2, LRRK2, alpha-synuclein, Parkin, PINK1, DJ1. PINK1 is a mitochondrial kinase and DJ1 is a protein involved in protection from oxidative stress. Which of the following about Kufer-Rakeb syndrome is false? See, this Kufer-Rakeb syndrome (KRS) is a rare autosomal recessive form of nigrostriatal pallidal pyramidal neurodegeneration caused by ATP13A2 gene mutation, presenting as juvenile onset Parkinson disease. It is rapidly progressive symptoms of Parkinsonism, spasticity, supranuclear upgauge paralysis, facial fascial finger mini myoclonus, visual hallucination, oculogyric dystonic spasms, and dementia, usually noted between 12 and 16 years, leads to severe motor handicap. So the correct answer here is D, none of the above. It is awesome. It all of the above. In fact, the option given wrong. It's all of the above. This is caused by ATP13A2, supranuclear upgauge paralysis, facial fascial finger mini myoclonus. So it is all of the above. The D option is all of the above. The only oral agent that reduces dyskinesia and impairing Parkinson feature is A. Selegiline, B. amantadine, C. bromocriptine, pergolide. It is amantadine. See, this amantadine is an antiviral agent. It is the only oral agent that reduces dyskinesia while improving Parkinson feature. Swollen axons of Purkinje cells are called as missiles, torpedoes, gun barrels, cannons. They are known as torpedoes. So the correct answer here is B, torpedoes. Which of the following is a gene for isolated dystonia? TOR1A, TAP1, ANO3, all of the above. Correct answer is all of them. Well-established genes for isolated dystonia are TOR1A, TAP1, THAP1, ANO3, GNAL, and KMT2B.